navigate them to definitive intervention for those issues as well.
So in the background, there's a physician who is on call for telehealth consults for the day, dedicated to that as their sole duty for the day. And that physician will now need to be activated or let know that there is a patient that needs to be seen. James can click a button within Pulsara that will ping me on my cell phone, and I can log into the cell phone and take a look at all the documents that James has uploaded. So I can see the patient's vital signs, I can look at the history or present illness and physical exam form that he completed. James may also have done things like load an EKG if the patient had some chest pain with their cough, or he may have gotten a blood sugar or a D-stick for me if the patient's a known diabetic. All of this healthcare data is within the Pulsara app, and as I am pinged by James, I can log into the patient encounter. I'm added to the patient care team, and I can view all the records that James has obtained before he has consulted me. So what you see on the right side of the screen here is what it looks like on my cell phone. I get a little Pulsara blurb that pops up. It makes a rather annoying noise that lets me know I have some work to do. And then on the left side of the screen there is me getting my alert. And then I click a button within the app, and I'm now connected with James, or my community paramedic. So you see James in the center of the screen, and me in the top right-hand corner, and we are now engaged in a telehealth visit.
So one of the unique things about this program is it really creates an amazing partnership between the community paramedics and the physician partners. We really get to know each other really well, and we interact very effectively with one another. And that's been such a cool side effect of this program.
So James and I will now work together for me to evaluate the patient. I have my own T-sheet or paper document that I complete as part of the physician telehealth billing record. It also will be photographed and loaded into the Pulsara encounter. We may work together to have James do a specific physical exam finding for me. I can watch him examine the patient's abdomen, or I can request that he listen to heart sounds, check capillary refill, examine the lower extremities for edema. So he can be physically present, performing physical exam under my direct supervision and observation. So as a team, we evaluate the patient, make sure that I have all the information that I need in order to help make decisions for that patient's care. At the closure of the case, so in our example here, we have collected a COVID-19 specimen, which James and our community paramedics will take to the lab, and perhaps we have scheduled the patient an outpatient follow-up with their primary care provider in 24 hours. Or maybe we've agreed that James and the community paramedics will come back tomorrow to reassess the patient. In any regard, we've completed our telehealth evaluation of the patient within Pulsara, and all the documents are now photographed and loaded into the software program. And then we export this to our billing and coding company. This is a simple single PDF file that contains all the discrete data points, start time and end time for length of telehealth visit, the vital signs, the physician and paramedic history of present illness and physical exam forms, and then a brief medical decision making that I document on my form, as well as a disposition. Interestingly, through Pulsara, you can integrate these directly into your EMR. We are not currently doing this in our system, but you can generate a link that will load the documentation into, for example, an Epic encounter or an Epic software system platform, so that all members of the care team can see the information that was generated during the telehealth visit.
And you could do the same thing from the EMS side, which is absolutely fantastic. You can upload it into ESO or Image Trend or Zoll billing, whichever product you use. Because it's a standard PDF form, you can upload it into any of those EMRs.
So the next thing I kind of want to do is give a little homage to our sponsor today, Pulsara. And I'm just going to work through kind of why we utilize them as our solution here in Colorado Springs. The first thing is that for those of you who aren't familiar with Pulsara, it's a pre-hospital communication platform that's used nationally, most historically for patient communication around high-risk events, so like ST elevation MIs, We can utilize Pulsara to transmit EKGs, to activate cath labs, to communicate to the ER that a patient's coming. And in our healthcare system and community, we utilize Pulsara universally across almost all of our EMS agencies and hospitals. So it is a platform that our medics and paramedics were already very familiar with. They interface with it on a daily basis. They utilize it to communicate stroke care, trauma care, STEMI care to our hospitals and subspecialists. The second thing is that, it's a HIPAA-compliant platform. So we are able to communicate healthcare communication and data in a HIPAA-compliant fashion for our patients in our system. And then lastly, when we started looking at how can we bill and collect under the future of ET3, and as telehealth has expanded its scope and billing process, Pulsara generates a very nice billable document that we can transmit to our coding and billing companies. So it sort of met all the needs of our community to integrate into a telehealth platform.
And so as we look at ways to integrate or ways to utilize this product, like we've talked about already, we're able to use it with 911 calls that come through PSAP centers. But I think that's the tip of the iceberg here, and the not so distant future. When I say that, I'm talking in the next, before the end of the year, we'd really like to start utilizing this to support other aspects of our business model. And that includes direct hospital referrals. So think about patients that are being discharged from the hospital that are at high risk. These are the patients that we see every single day that we're taking back to the hospital because there was something lost in that transition in care. And those transitions in care from the hospital home or from the skilled nursing facility home, those are when the patient's at greatest risk for dying and having bad outcomes. So if we can integrate that so that a community paramedic comes and visits that patient when they're discharged from the hospital, and we can power that with a teamed partnership with a telehealth physician, we're really increasing the power available and that program. So think about a patient who's released for a hip fracture or a patient who's released because of a recent stroke. Now we're going to come into the house. We're going to do a fall risk assessment because falls are the #1 reason that patients bounce back. We're going to make sure that they got the medications that they were supposed to get upon discharge. We're going to make sure that they understand how to take those medications and the risks and benefits associated with those medications. We're also going to make sure that that the oxygen was delivered that they were supposed to have, so that all those aspects are in place and the patient understands their discharge instructions. Because when a patient's released from the hospital, more often than not, all they hear is blah, 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 you get to go home. Then they get home and they're faced with this stark new reality that is, I'm home, I'm alone, and I have no one. We want to be that someone. We want to be that support so that we can help them make sense of their discharge instructions and be part of the team that makes them successful. We empower them to be successful upon their discharge.
We also have partnered with skilled nursing facilities and long-term care facilities. We already have contracts in place with some local facilities here in the Springs that will enable to initiate a Pulsara physician telehealth visit rather than transport patients directly to the hospital. And as you can imagine, in a group living situation, if COVID-19 is the concern, a telehealth visit before transport could be very helpful in helping to prevent spread and transmission of the infection. And then we're also looking at how do we do emergency department follow-up or urgent care follow-up. So a CHF patient, for example, that gets diuresed in the ER and goes home with a home oxygen script and a new script for Lasix, it would be fantastic to have a Pulsara-initiated telehealth visit the next morning, making sure that they got their oxygen, their diuretics, their cardiology follow-up is scheduled. So we see this telehealth connection through EMS and community paramedicine as sort of the tip of the iceberg here with regards to expansion. So we already walked through most of this on a prior slide. The concept here is that Pulsara is already used in our community, so it's easy to adapt to a telehealth model. It definitely meets our HIPAA requirements, our billing requirements. And interestingly, we're going to talk to you a little bit about how we can utilize it to connect other parts of the team.
And one of the cool things about switching to or using Pulsara for this is, as Matt said, our providers were already comfortable with it. They were already familiar with it. And when you're asking them to do so many new things, so many different things, having a tool that they're comfortable with and that they're familiar with goes a long ways towards adding comfort and instilling some confidence in your providers. So the important thing to understand about a project like this is it doesn't exist in a vacuum, and anybody who started a new program or a new project in their community can attest to this. This is done only through a collaborative partnership. To ensure long-term success, you have to make sure that the local physicians are involved, the primary care providers, the ED physicians, all your local specialists, and then also your social services and your social support programs, such as Department of Human Resources, Teller County, or in our case, it was Teller County Public Health, and then our OEM, our Office of Emergency Management. And we've made sure that by tying DHS and Teller County Public Health and the Senior Coalition into this project, that we were able to provide complete wraparound services. Because it's one thing to come into somebody's home and just provide care, and then say, hey, good luck. I hope everything works out for you. By the way, stay in your house for 14 days and don't leave for any reason, right? It's a totally different thing to say, we're going to need you to stay in your home for the next 14 days, but don't worry because DHS is going to be contacting you in the next few days to get you set up with food and other supports that you need. If you need anything before they contact you, here's a direct number to reach out to them. They're going to be familiar with your case, and they're going to be familiar with what's going on. So by tying that in together, we can make sure that we're treating the whole person and not just the patient. And we call that the biopsychosocial model of medicine. We're treating the physiological aspects, the emotional aspects, and the spiritual aspects of the patient's needs.
Okay, so we've touched on this a little bit, but I kind of want to go through where do we see the future of this telehealth platform and as it connects with EMS and community paramedicine. I tend to personally focus on the transitions of care, and we've touched on some of that briefly. Patients that are discharged from the ER to home or from the hospital after an admission, patients that are in a skilled nursing facility and maybe transitioning to an urgent care ER. We can leverage the Pulsara platform and this telehealth platform that we developed for COVID to provide needs for all kinds of transitions of care scenarios. Obviously, our fundamental goal in utilizing the telehealth platform is that we can reduce the risk associated with these transitions of care, improve communication and the patient experience. We can expand this telehealth platform to the 911 PSAP tiered response model. So we said at the beginning of this presentation, roughly 30% of 911 calls don't require emergency department care or transport. It would be fantastic to tier patients under certain guidelines and criteria into a telehealth Pulsara visit as opposed to a 911 physical response. We certainly see the future of ET3 and billing. We were fortunate enough to have Teller County and UTPass selected as an ET3 demo location and our AMR Colorado Springs units, but we have a way to bill and collect for alternate destinations under ET3, and we can leverage this process that we developed with COVID and Pulsara to a multitude of other telehealth platforms. And then obviously we talked about integrating more with hospital discharge planning. We certainly see a cost savings benefit to preventing bounce backs or readmissions. So the potential is huge for the expansion of this telehealth platform in our community.
So, and when you talk about partnerships, it's going to be increasingly important as we move forward to become the value option in our community. And what that means is the payers see us as a value because we're reducing unnecessary transports, but also our other partners see us as a value in our ability to get them time-sensitive information so that they can better manage their patient populations. And in doing so, we'll be able to utilize other specialties such as orthopedics, cardiology, geriatrics, and pulmonary and pulmonology. And we are already utilizing this very same concept to address the very complicated patient population that is behavioral health crisis and medication-assisted treatment or substance use disorder crisis patients. So what we're doing right now with this very same technology is we are able to arrive on scene for patients in behavioral crisis, de-escalate the crisis, medically clear them on scene utilizing an evidence-based tool, and then alternatively destinate them safely to destinations such as inpatient behavioral health facilities, community crisis stabilization units, walk-in clinics, and even get them set up with outpatient services such as behavioral health and medication-assisted treatment. This has been an amazing tool for our community, and in the time that we've been doing this, we've seen over $3.2 million in downstream cost savings by alternatively destinating patients to definitive intervention.
So, in summary, I believe that COVID-19 has sparked our community paramedics and hospital systems to meet the quadruple aim. We're leveraging this technology to improve the provider's experience, to improve the patient's experience, to improve population health, and as James just pointed out, to reduce the total cost or healthcare burden cost in our community.
So, as a leader of your organization, and I believe everybody has an opportunity to be a leader within their organization, as a leader of your organization, I would ask that you ask yourself these questions openly and honestly. Is your organization ready? Do you have the tools and partners identified? Do you know who you're going to need to work with? Do you know what equipment you're going to need? Do you know how you're going to get that equipment? Have you set the expectations and prepared your workforce? I mean, do you understand what your vision is and what your community's needs are? Have you done a community needs assessment? Do you know where the healthcare weaknesses are in your community and where you're the value option for those needs in your community? And then have you set that expectation for your workforce? Have you set that vision out there so you know where you're headed? You may not get there today, you may not get there tomorrow, but do they know where your organization is headed? Do they see that vision? And then have you prepared them with the education and training that they need? Have you offered them community paramedic courses? Are there community paramedic courses offered in your community? Does your state have a community paramedic program? What does that look like? And if the answer is no, if you're not there, then I promise you there's another agency or another entity that is going to get there. We know this because as we were building our program, we had multiple home health care agencies reach out and say, well, if they can't provide this service, can we? So if you're not going to be that value option in your community, I promise you someone else will. And that's not where we want to go. So